Is it reasonable to say that Fletcher Allen here in Burlington has everything that anyone could need, or?
Not absolutely everything. There's certain pediatric cardiology that we send to Boston, and that makes sense too. Because you don't want to reproduce, you know, if you look at services, there's a certain infrastructure that goes along with having a certain service available. And we may not have the population, and within that population, the need to sustain that service. So you don't want to have to erect it if you can buy it in some other place. And that's what we do right now when it comes to certain services. People along New Hampshire border, they go to Dartmouth, and we purchase those services from Dartmouth. That makes sense. Instead of reproducing just so we can say it's a Vermont-made service. I mean, it makes no sense. We purchase those services just like we do in Boston for pediatric cardiology. So there are certain services that are too expensive for us to reproduce that we actually could purchase from some other place if someone had the need. And that actually makes more fiscal sense. And I'd like to add that when we talk about spending money in, you know, conservative versus liberal, single-payer health care is actually the most fiscally conservative way to cover all Vermonters comprehensively. We get a whole lot more for our money, and it certainly saves money in the end, but it is the most fiscally conservative way to cover everybody. I think it always gets looked upon as, how can we possibly afford this? We're not talking about adding more money to what we're already paying. We're talking about shifting what we're paying for within health care. So we're going to spend less on paperwork and shift that money to spend more on medical care so that everybody can get the services that they need.
I remember maybe a couple decades ago, everybody used to have Blue Cross Blue Shield, and it wasn't expensive, and it covered pretty much everything. And then I remember on the news there were these cases of fetuses that were born prematurely, and they had to go into incubators, and then they advertised the cost of this. It was something like $1 million per fetus. And that, I think, really turned people away from the idea spending as much on insurance, and that's the point at which companies wouldn't pay for insurance anymore or supply it to their workers. And, is there something to prevent the money from being wasted like this? $1 million for a premature fetus that may not survive anyway, it seems rather excessive.
Well, but see, those are societal decisions, and what we need to do is decide as a society. What services do we want available should our loved ones, should we or our loved one get sick? And that can only be decided within a healthcare system. Some of the things you're talking about, first of all, the number of babies born that need the neonatal intensive care is actually rather small. The number of people that use the burn unit or the trauma unit is very small. But do we want to have those services available? I think most of us would say yes. But they are very expensive. And so the costs of those have to be shared by the whole population. And that needs to be the way we have to look at it. Not, gee, should I buy insurance for that or that particular service. We need to look at what services are needed for the whole population and how are we going to pay for them. And that's why we need to share in paying for them. But we need to share in that payment fairly based on your ability to pay. The idea of whether we pay for a certain premature baby to be in that intensive care unit, that needs to be a societal decision. Are we going to just let those babies die? That's really up to society. How far into end of life are we going to take care of people? If someone is 95 and they're dying of cancer and they also need coronary bypass, are we going to pay for that? That is a societal decision. And at this point, we don't have any mechanism in place to be able to make those kind of decisions. That's why we need a healthcare system.
I think it's unfair, too, to put the burden on the family to make a decision. For instance, if it's a premature infant, the mother and the father, they're not going to say that to pull the plug. But if a general society makes a decision, at what point the plug should be pulled, it would be much easier, and the burden wouldn't fall on the family.
Right, and there, in most hospitals there's actually an ethics board that helps families deal with this, because I think the real problem here is that you're stepping on people's hope, and they're always looking at, they see television of, the child who survived and was maybe, 24 weeks and they did fine, and they're you know, they're going to kindergarten and everything's great. And really what needs to be assessed is what is the likelihood that this child is going to end up in that situation. And families are under tremendous emotional stress when this is happening. And this really needs to be sort of a team approach where this isn't imposed upon by the government. This really needs to be something that the joint decision between the healthcare practitioners and the family, and perhaps the ethics board within the hospital. That's usually how some of those decisions are made. We have to remember, though, there really is more than enough money in the system to pay for premature babies also. I mean, we are paying far more. We could pay for every possible thing you could imagine with the amount of money that we're currently spending. The real question is, do we want to continue on this trajectory of spending these huge increases in healthcare every year? I think we have to look at this again as a society and invest more in health activities, so public health and prevention and primary care, rather than investing in services when we've already gotten very, very sick. So that's really, again, why we need a healthcare system where we look at this as a whole. What does the population of Vermont need? We need more substance abuse treatment. We need more prevention. We need more primary care. But we need the funds to be able to funnel the money to do that. That's, again, why we need a system.
You referred to the benefits from specialization. Mm-hmm. I'm in the MBA program at UVM, and we were looking, last night we were looking at a case in Toronto of Shouldice Hospital, mm-hmm. and they do nothing but hernia operations.
Mm-hmm. Right.
They have 89 beds, and each patient stays for 3 nights, 4 days, and there's a waiting list of 1,200 patients to get in. But the doctors there are 12 surgeons, I think, and
that's all they do. That's right.
But they're very good at it.
Yes.
Better than anybody else, and it's cheap too. Mm-hmm. The price is half of what you pay in the U.S.
Right. And that's what, in fact, Canada is famous for, and most other countries, is basically they have specialty hospitals that only do that particular procedure, only will do cardiac transplant, will only do kidney transplant. That's all they do. And when you look at, in fact, the surgical specialties, there's a certain minimum number of surgeries per year that you're supposed to be doing in order to be skilled at that. And let's face it, practice makes perfect. Do you want a surgeon that just does 10 of those a year, or a surgeon that does 150 of those a year? I mean, I think we all would agree we'd want the one that has more practice. And this is something that actually ends up saving money, because you don't need to duplicate the infrastructure, the nurses, because this isn't just about the surgeon, it's also about the surgical team. There's the nurses and all the OR staff and that sort of thing that are needed, and they all work together. It's almost like a dance, you know. They certainly know how each other operates, and that's why you need those areas of specialization. In this country, unfortunately, what we do is we have specialty hospitals, but they're only hospitals as a source of profit. So you have the more well-funded specialties. They tend to siphon off those and form their own specialty hospitals here. So we actually have more of a profit motive in our specialty hospitals in this country. It's unfortunate. That's why we need a healthcare system.